So I think um, we are we at um, this question? I think we ended with, do you hope to provide resources for prevention and wellness, right? Or array of resources. I think that's the question we start with. Is that correct? Okay. So the question is, do we hope to provide an array of resources, both traditional and non-traditional? Will our list include therapists, support groups, prescribers, peer support, and social support? How about prevention and wellness? Birth and postpartum doulas, sleep coaches, lactation consultants, naturopathic physicians, physical therapists, massage therapists, yoga, acupuncturists, and beyond. So among our group today, what do you think? Where do you think we need to go with this?
And Dana, real quick before we kind of start brainstorming, do you or Megan have a copy or the draft of that one sheeter resource page that we could show the group what the one side that has the resources on it looks like now? Just kind of so that we have that in our brains as we're thinking about this, to think about like how much that this is really intended to like fit on one sheet of paper, because the other side is that infographic,
I guess, yeah, we have
that was created by HMHB.
Yeah.
Right.
I pulled up just the quick example from the Flathead Community Council that uses the template that Healthy Mothers, Healthy Baby designed. So you can see, to Jacqueline's point, here's the infographic that shows up on the first page, and then the second page has those resources, and it's kind of broken out between mental health support, providers, other resources, breastfeeding. So it is that kind of one pager example.
Yeah, so I think that's just important to keep in mind, that we're not like putting a booklet together. It's a one pager. So I think we have to think about that when we're thinking about what all are we wanting to include. And then the other piece of it is just if this is a printed material, or even if it's not and it's on our website, some things tend to be more consistent than others, and being thoughtful of that too when we're putting things on, so that we don't put something on that in a few months might have gone away or might have changed, and now it's a dead end for somebody who's using this like kind of in a crisis and looking for support.
Right. And I remember from our discussion way back in maybe February or March, maybe it was March when we first met on Zoom, Claire had mentioned that, for her, given that she's, struggled, she wasn't really interested in the wide range of everybody that could be included as wellness coaches, or, she was really looking for, she wanted something that could point her directly to support and intervention at that moment. So I agree with, given that we have a one pager, how much do we put in that? And, do we include everybody? I mean, it sounds like a good idea to include everybody, but you're right, it's not gonna, is that really feasible? And, what is our goal here? So
I think it could be useful to consider how that one pager and a website, a living, breathing website, could work together, because maybe you put kind of that intervention piece, considering that whoever we're distributing this to, if say it's to doctors' offices or the people who are most regularly communicating with these mothers, like they might need this as a way to provide a quick vetted intervention, right? But being able to direct back to like a URL where they can go through even more resources. We could build out on the website like robust accordions of even more people, or say if you want wellness specific, make sure that you return to the website. So maybe the one sheeter is smaller, but having the larger version elsewhere.
What about some other community resources that are already in existence? So Megan, you were saying, something that is kept current. That would be an online resource, but something like Connect that is already in existence and could be kept current, not even necessarily by this group, that is kept current by another group. So using Connect or using 2-on-1, something that that this task force doesn't have to be directly responsible for as well, but is kept up to date because they're one of our community partners.
I was totally just thinking the same thing. I'm glad you brought that up, because yeah, it makes total sense to use Connect and have them do that.
And I think we should make sure that whatever else we decide to have on there, that the crisis line and the text, both the text and the call suicide crisis hotline numbers are on there, because if someone is really, really in a crisis, we want them to see that resource.
Right. I think yes, and we need to include the PSI number as well. So, I mean, what I'm hearing, I think that for the one pager, I think we should really focus on those resources that are traditional, that are, the psychiatric piece, the prescriber piece, whoever that is, the therapist piece. That would be my thought, and perhaps some other resources as well. I would definitely, if we do get group peer support, I would want I think that would be important to include. And the reason I say that is because a lot of women would go to a peer support, might reach out to peer support long before they reach out to a provider. So that's my thought. Other people's?
I absolutely agree, Dana. Super, super helpful. Important.
Okay.
Yes, I agree as well, Dana, on that. And I also think that the one pager focusing on just some more traditional interventions is good, just because I also am very open, in working with patients, like everybody has a different path of healing and wellness, but I find that some of the more, like yoga, massage therapist, acupuncture, chiropractors, like those are kind of a higher level of intervention that, layered together, all these things help somebody. But if they're like in crisis and they need that one person, or, like kind of saying, like, with Claire thinking, like having that perspective of like, I just wanted to find what would help me the most in this situation, that like those other more non-traditional things can be put on a website, but not on a flyer.
I agree. I mean, the website could have a lot, and I don't know if we can just direct people to that in some way, so.
There are ways too that, just going back to that, when you need a resource, you want that resource immediately, but you have to know that it's available to you too. And I'm new, so I'll just ask this question. Are there ways of figuring out how to pay for those things? So which providers take Medicaid, or which providers, will do it on a sliding scale, or have, some other method of that? Is that part of that vetting process, and in having providers on this list or another list?
That's an excellent question. I don't think we've ever really addressed that question. I know on, if you go to Connect Referral, if you use that system, definitely you can find who takes Medicaid, who doesn't, who takes Medicare, and that's really helpful. I don't think as in this discussion for the resource guide, unless somebody has a different memory, I don't think we've ever thought about that question. And if that would be part of the vetting process. I mean, that is one of the questions we have to ask. I mean, we have to address today. So something for us to maybe ask that, when we talk about vetting, do we ask that question? So, and I know Jacqueline has to leave. She's got another meeting. So thank you for your input today. Thank you.
Thanks, guys.
So, but yes, I think that's a very important question to ask. And so maybe, I think that's down like where we go, are there enough trained providers? When we get to that question, maybe we put that in as a possibility. So, because that's clearly important, because, you can get a person who is on the list and then you find out they only take a very select insurance, which often isn't Medicaid. So, all right, other people on that question.
I have a somewhat related question. And I'm not sure if it quite fits in here, but one thing that kind of came up after the conference and just like in conversation between Bree and I was on this resource guide as a whole. We're collecting this. There's nothing about like bereavement services for like little ones. And I think that maybe we might look at when we're doing our vetting process, including kind of that scope of thought.
Well, I think that is definitely something to include as well as is bereavement, child, pregnancy loss, and also in the postpartum loss, early loss. So, because I think, we definitely are going to find women who are in need of perinatal mood and anxiety support because of that. So yes. Okay. Other thoughts on this question? Do we feel like we've kind of answered what we want right now? Is that okay? So I think the next question that we're going to is, will you expect a more in-depth level of perinatal mood and anxiety disorder training for health and mental health professionals than those that might be offering wellness support? That's an interesting question. I hadn't thought about that. So
I've actually thought about that a lot.
okay, well, good. Let's hear what you've had.
Well, I just think that, that's really what would really set providers apart, in being on this particular resource list, right?
Right.
As a psychotherapist, I can say that I work with that, but I wouldn't want to trust that unless that I had some specific training specific to it. And maybe that could be, attendance at the annual conference, for one thing. I also think, and I should know this, and I've been kind of wanting to look into it, somebody else might know, but, Postpartum International, that's what it's called, right?
Right.
It has training offerings, I think, certifications. Anyway, so I think looking more closely at that when we get into detail, about what we would want folks to have could be super helpful too.
I agree. I mean, I think that if we're including the sort of paraprofessionals or, wellness support professionals on the, in some sort of listing of providers, I believe that they do need to have at least the initial 2-day certification training, because we don't want, what we wouldn't want to say is that this person who's a massage therapist or yoga instructor or whoever, and that they work with women in the perinatal period, and they have no idea what depression is, or what obsessional and thoughts are, and they don't understand it, and they give the wrong resource, or they give the wrong comment, or they could screw it up. I guess.
Or don't know to refer to,
right, or say
mental health person, for example. Yeah,
right,
I agree.
or they say, oh, you shouldn't be on medication. If the person says I'm on medication, well, you should, they might give something like that, and that would be disastrous.
Agreed.
So, other thoughts?
My only other thought was I had gone to that Ann Diamond. It was an online, training with Ann Diamond on trauma-informed approach, which of course is sort of related, not quite the same, but related. And I was thinking, so many people are now getting training in that trauma-informed approach and on ACEs. That it's not quite the same, but it kind of holds hands with the anxiety and mood disorders. And I'm wondering if that's a piece of that as well, that if a practitioner is informed on that trauma-informed approach, in addition to the perinatal mood and anxiety disorders.
I think that's an important piece as well. Yes, I agree.
Yeah, I totally agree. Good point.
So, anything else about? I think we're on consensus here that those professionals that are maybe not prescribers or therapists we would like them to have additional training and certification, and so that they can say, yes, I have attended this, I do have certification.
I think it's a good opportunity for us to provide that sort of awareness and education that we aim to bring, is we have those resources that they might not have even been aware of as a training opportunity, right? So we can say, you're serving people so well, and if you do want to serve new mothers effectively, let us direct you towards this training. And there's even some free trainings out there that I've seen that we can be of a resource to them in order for them to be a resource to these parents.
I think that's an excellent,
Yeah,
comment.
I do too, Megan. Very good point.
All right. So, will you want to provide resources for recovery and repair from a perinatal mood and anxiety disorder, for example, attachment-based parenting or circle of security classes? So, thoughts, ideas, being I'm thinking yes, I guess.
Yeah, I'm thinking that's a kind of a no-brainer, but maybe not. Absolutely, right?
Well, I think so, because and of course, but I think when we're working with, especially certain families, and maybe all, any family, when there's been a perinatal mood and anxiety disorder, it does disrupt attachment, it does disrupt parenting. And so I think having resources like Circle of Security, and there's other ones out there as well, and that are evidence-based. Obviously, we want to use the most evidence-based parenting, but yes, an attachment-based. including, parent-child interaction therapy, which I think is really key too. So.
I'm so glad to hear you say that, Dana. I didn't know you were a fan.
Oh, I'm a huge fan, Pam.
Oh, good.
So you do that, right?
Well, I helped bring the training to the state several years ago, and I got trained in it. I'm not certified, so I don't use the whole thing, but I have 2 partners in my office that are, so it's good
Okay.
stuff, for sure.
It is good stuff, and I've seen it work wonders.
Good.
So I definitely believe.
Good to
Yeah,
hear.
from like receiving that type of training, like we had a family counselor work with us to help like strengthen our communication using parent-child interaction therapy with our 8-year-old, and we just saw like a huge difference how just like 5 minutes of like interactive play a day can just like skyrocket their confidence. So it was really, really wonderful to learn that.
That's really cool to hear too, Emily. Thanks for
Yeah.
sharing that.
Yeah, absolutely. It's good work.
So, okay. Any other comments or thoughts on that question?
Yes, I think it's like absolutely important to include, and I have been through Circle of Security myself, and am very transparent about that with my patients, and just encourage people to, I say I've taken this myself and it's an amazing class, encourage people to go. And I got a couple of my coworkers to go. But I just feel like, these, like any of, the Circle of Security or the parent-child interaction therapy, like those are things that you can use at any point. You don't have to be, it's great if you can do it earlier on, but you can be further out from that child being a baby, and it still is very, very helpful with relationships and strengthening them.
That's an excellent point.
Yep. I think I'm also a Circle of Security trainer, and I believe that everybody should have Circle of Security if you're a parent or are thinking about being one.
Or even a grandparent.
Yeah, right. Exactly.
I mean, I think it's really, and we just need to definitely keep pushing it, keep advocating for it. So
I think it's an interesting point that you all raised too. And Kelsey, you were saying, that you talk about that you have this, that you've gone to this class too. And I think because of sort of the inclusive nature of what this resource guide is intended to be, or the one pager is intended to be, that it's really open to all families. And there's not that sort of, I think oftentimes in these services we get, it's either income based or it's something else, or, you're at risk or you're not at risk. And I think a lot of times if the message to the community is, look, we want healthy community, healthy babies, healthy parents across the community. And that means we all do it. It's not geared toward one group or another group. So that's a really powerful message, I think, for families across the board.
Oh, absolutely. Absolutely. I mean, that's in the sense that we are all in this together, and our goal is to have healthy families in Helena or Montana or Lewis and Clark County, to help everyone, because it's not, we all know that these issues that happen in families are not just income based, and so yes, I agree. All right, should we move on? Moving on. Might this be an opportunity to educate the community around the term perinatal versus postpartum? Perinatal means wraps around birth, and thus includes the road to pregnancy, the birth, and the postpartum period. PMADs occur throughout this period and sometimes beyond. And I just think that that's a yes as well, at least from my standpoint, is that we really need to not focus on postpartum, but to say to people, this is the perinatal period. And it is, because I've worked with a number of women who, I have one woman who's about ready to deliver, and, you know, I worked with her before she got pregnant and when she was thinking of pregnancy, and then working with her through her pregnancy and helping her, and hopefully, you know, she'll be delivering soon, and hoping, and then I'll be with her in the postpartum, and we've just been, you know, dealing with all the issues that have come up for her with her. She already had a diagnosis of a perinatal mood and anxiety disorder. I mean, she had a mood disorder before she started on that journey, but, you know, it's been really helpful. And I think people need to know, because I think a lot of people just see it as postpartum. So. Other comments?
I agree.
My dog has an opinion.
Oh, okay.
I agree with you, Dana, that it's a great opportunity for education.
Okay, great. Yes. I mean, I think that's also part of who we are. And, you know, as this task force within the ECC, is that we're here for education to the community and helping them understand what this is. So. All right.
I think I have one more thought on that, just thinking of trying to get our community continuing to think upstream. And that was such a great example, Dana, of your patient that you started working with even before pregnancy, that the further upstream we can go, the more we can support somebody all through that process. And then we're not reactive. And that's where my job really started, very reactive, and trying to move that up, because I'd much rather support somebody all the way through than have this huge crisis at the end. And I think as a just people out in the community, you know, that's something that I think professionals have talked about for a long time, but just getting everybody to think that way would be a huge benefit.
Yes, yes. Okay, so here we go back to that question of vetting, and are there enough trained providers to use a vetting process? So first, kind of to ask, you know, are there enough trained providers? I mean, we have more, and we you know, since we started with the conference, you know, that first started in 2018. So we've had 3 conferences now. We might have a few more. I definitely think we have some people that have the initial certification, you know, the 2 days, they've attended the 2-day training through PSI, or perhaps postpartum support. Well, not just PSI, but I think, is it Mental Health Now? Maternal Mental Health Now has an online training, which I think is important for everyone to have. I also, though, believe that for providers who are giving medication, and probably providers who are therapists, really need the advanced level as well. And I don't know how many people have that advanced level of training. I mean, I don't know. So that's my thoughts.
One that I had, well, Emily and I have been starting to add names to a list of just local providers that we can find. And one of those lists came from Julie Burr on my team, who just had a list of all like mental health professionals. And it kind of talked about their focus. Some focus specifically say like postpartum or pregnancy. Some say like women's health or couples therapy. And I think when we consider how we're talking about parental mental health now and wellness, I do wonder, like, how do we distinguish between providers who might be helpful for is dyadic the opposite of what I want to say? I just watched the session where the gentleman was talking about. You want to include both the mom and the dad, right? So it's
Right.
like, how do we make sure that we're including both the therapists that are specifically saying, like, I serve postpartum and pregnancy, or just women, as opposed to the therapist who might serve both. I do wonder if you at least want to vet through that list or kind of distinguish what the expectations are of those types of providers. Does that make sense?
Mm-hmm. Yes. Yeah. And so, I mean, I think when we think about it, I mean, my thought is we don't have, I mean, do we have enough trained providers to even begin using a vetting process on them? And I don't know, but I mean, for those of you that have been with us for a long time, what do you think? I mean, I think we have certainly a subgroup of providers, but if we look at all the providers in Helena, for example, who say they serve women or say they serve pregnancy and postpartum. I just talked to a certified nurse midwife today who had no knowledge about a medication I was using and its safety in pregnancy. And I was surprised, you know. So, and she was questioning my judgment in having put this woman on that medication. And I've had a lot more, and I'm not, obviously I'm not a certified nurse midwife. I'm a psychiatric nurse practitioner, but I've had many women on this particular medication now, at least I could say a dozen probably, and have, you know, watched them through their pregnancy and monitored them. And she was, she had outdated information about this particular medication. So that was really eye-opening to me.
From what I've just encountered with my work, I know of one therapist in Helena that has the PMHC certification. Otherwise, it's just kind of like a, you know, people that have had a focus and a passion and might, you know, some of those therapists might have some training, just not a certification. And then as far as medical providers, Dana, we've got work to do. I just like so this is the first time that St. Peter's was able to send two providers to the perinatal mental health conference, and they happened to be, one was our psychiatrist and the other was our psychologist, who are very amazing people. But I tried hard to get some of our family practice providers to go, just because I think it's so eye-opening. And unless you remain up to date, you know, on these things, you might not be giving the patients the most accurate information. And so as far as providers, I think that it'd be like amazing for them to take these trainings, although there's kind of a tough thing on time. So I had two of our family practice providers that deliver babies signed up for the conference, but then when it moved to the virtual platform and was over 5 days rather than a Friday and Saturday, they just could not do that with their schedule, unfortunately. And so I think sometimes with these types of things, as much as they're so, it's just so rich and so much powerful information, that the time is a tough situation. And especially right now with COVID and nothing is, it's all kind of wonky. But yeah, I mean, I don't know like the best way to reach people. I help with some of that education in my own organization and have to start small before I start networking out to our OB clinics. But it's definitely a huge need, and it's been sometimes shocking to talk to people about the perinatal period and things, what information that providers have had, and it's very outdated. So so there's a lot to do. I don't know that there's any, especially with the OB providers or even the family practice providers that deliver babies. I don't know how much information they have on this, how much training they have, even their staff. And that's another piece, like I'm looking at too, but like one of my coworkers had mentioned, she's like, when I listen to you call your patients and do Edinburgh screens and really talk through, supports and everything you can offer for somebody, she's like, I had a totally different experience at my OB provider's office. And she's like, I answered honestly, but had I really been struggling, I don't think they would have done anything for me.
Right.
So yes, and I've spent, a long time with my job. I have such a passion. I have networked as much as I possibly can and really can effectively help people or get people connected to help. That's a big piece. But there needs to be need to be able to share that and more people doing that as well.
Right.
I was just wondering, as a, we talk about the vetting and then what are the criteria and who decides on that one. And as you were talking, it occurred to me that instead of the vetting, kind of saying who's in and who's not, what about a piece that has, all of the practitioners listed, and then, training on the side, this person has taken this training, or this person takes Medicaid, or this person, et cetera, et cetera. Okay. So you have kind of I'm trying to use my hands, which is terrible on Zoom, right? But you have sort of this column or a table on the side that lists practitioners, down one column, and then what their training has been. Have they done it? And that's something that could be updated every year, because you could ask a practitioner every year, have you done this training this year? Have you attended this conference this year? Et cetera, et cetera. So it could potentially change from year to year on if folks are up to date or not. I think one advantage is it doesn't put any particular body in charge of vetting that person. It just allows the consumer, allows the family or the person to judge, do I want that for myself? So that's just a thought on vetting versus providing information.
That's an interesting thought. I don't think we had really looked at that before. As a group, and I think it's something for us to look at. I see that as an opportunity for us to look at. I guess the question then is, so if we have a resource guide though, who gets on that resource guide? That's because we have that one pager that you saw. And so then, who decides who gets on that one, and would we only use those people that had the training? I have attended the advanced trainings. I've attended lots of trainings. I have not yet gone for the PSI certification as an advanced prescriber. And I haven't decided if I'm going to do that. I was thinking of it and then it just did not present itself. So would I, I think that the one thing I think is really important is that if we're offering information to someone who is in a crisis with a perinatal mood and anxiety disorder, that if we give them a list of here's some providers, or that they're, that we know for sure that they have attended, that they have that background, that they've attended the PSI trainings, they've attended some of the advanced trainings, they've gone to the HMHB's perinatal mood and mental health conference, because I think it's really critical. However, I think maybe if we're thinking of the broader list of people that we would have on, say, in Connect or on a website, then it would make sense to have maybe this is what their background is, and it does get updated. We do need, that's the other thing about this piece, is how do you keep this updated? Because Lewis and Clark County has a mental health resource guide, and I got it, and it's out of date. You know, it's in fact, in some ways, some of the providers that are listed are not even in Helena anymore. And you go, that's the downside, is we've got to have a living document that doesn't end up out of date, where it, you know, when I retire, I'm not here, but my name is on a resource guide, you know, or something like that. So anyway, but I appreciate your question, and I think it's something for us to, you know, as we move forward in this discussion, and maybe in December, we need to look at that. So other ideas?
Dana, I'm just wondering if we could just make a list of people that we know who have had training in with perinatal mental health, and just see who's on that and how many are on there, and then we can decide if we have enough to do a vetting process.
Okay. Yeah. I mean, that's a,
I was thinking kind of similarly, Sherry. I mean, one really easy, you know, crosswalk I think would be looking at all of the attendees from the last 3 years of the conference versus, you know, Helena practitioners. I think that's a good start. It's not the be all end all, but we can imagine, I mean, if you're someone that has this interest, has done other training on it, you're probably going to jump onto this conference, right?
oh yeah.
I mean, and you know, I've been to the last couple of conferences, but I haven't, you know, I haven't done any of the specific training through PSI, for example. And so, I mean, I could see a, you know, maybe listing like a group of folks that have, I don't know, had some training is not the best way to say it, but, you know, have a baseline knowledge, i.e. have gone to, you know, a conference, one of the conferences at least, and then maybe those that are also, you know, have specific certifications,
Yeah.
advanced trainings.
I think that's a good idea. And we can certainly, I mean, we did do in 16, we brought PSI's 2-day training, and we may have a list still somewhere floating around, because that's how we originally got this group together. So I think that, and Bree might have that. If not, I might have it somewhere, who at least attended that first certification. And you know, if you attend the 2-day PSI training, you get a certificate, you know, for having been there, and that you have you've learned about perinatal mood and anxiety disorders. And and I think it was similar to the 2 days that they had before the conference this time. You know, I think it was similar to what they provided in some ways. I don't know for sure, but
well, yeah, I didn't know that. That's obviously a great list to start with then.
Yeah, I think
well,
so we can at least also see how much, see it. I mean, if we started with that list too, my thought is then we could compare it to the list of the people that attended the other conferences, and see if they've done more, you know, gotten more education. So I did want to let everybody know, if you didn't see, that Jennifer had to leave. She had a family conference, and so she thanked us for having her, and I know she's planning to attend again. She's on our list. So are there other thoughts on that question? So okay, well, let's maybe move forward. And then are there, I think the next question, are there parallel resource referral efforts that you may want to integrate as a part of your project with, for example, 211, Connect, even if you have a printed and digital guide that is widely distributed, do you want to get all of the core resources to the 211 network? Are there other guides, websites, or information hubs that it will be important to integrate your guide within? So, thoughts?
I definitely think it's important to align as closely as possible with the work that Connect is doing, because they are trying to get more people onto Connect. It's free for anybody to sign up. And we're also trying to build awareness for patients to know that it's a resource to ask for, to say, can you refer me through the Connect system? So I think that's really important. I asked Julie at one point about the maternal mental health resources that we had in Connect, and I think she said there were 2 listed. So I think there's a huge opportunity for us to take whatever we find and make sure that not only are we making sure they're on Connect, but also within the guide encouraging parents to request these sort of digital referrals.
I fully agree. I mean, I think if I think the Connect system is something for us to really focus on. I don't know where we are with the 211. I guess I'm not as familiar.
That's, I was gonna chime in on that, and I only know enough to be dangerous, frankly, about 211. But whatever we do for Connect, let's kind of determine what might be also useful for 211. Not to duplicate, but see what's appropriate in that setting.
Okay.
Does that make sense? And like I said, I just know a little bit about 211, but I know that's a project that I may be helping with over at the United Way. So,
Okay.
so keep us posted if you do any updates to Connect. Okay.
Okay. And I think we do need to I mean, I'm a big proponent of integrating these things that I think we want to include other resources that are actively working on providing a resource list for people. So that's my thought.
And I have something else along the lines of Connect and something that is going on right now. So I'm also a part of the Connect advisory board. And earlier this year, so 2 of the social workers on my team pretty much called every therapist in the Helena community and area. And even I think they went out to Townsend a little bit and potentially Boulder, just to see if they're still in practice and what like major services do they provide. So kind of what are their specialties? However, they did not ask for specific certifications. So like that's, I think Megan, that list that you have is actually from the social workers on my team. So that's where it would say like women's issues or postpartum. But just kind of asking, what they felt like they specialized in. And then the Connect advisory board, we're trying to get as many of those therapists to join Connect as possible and also have more of a descriptor. So, you can, when you get onto Connect and you want to look for like couples therapy or, a perinatal, a counselor that would help in the perinatal period, that those descriptors would also be placed. And so we're dividing up that list to ask, have email communication and ask those therapists to be a part of Connect. But I guess where this could intersect is really finding out who else might be actually certified with perinatal mental health or have training with perinatal mental health.
Yes, I think I think it is a good way for us to know who's out there. Other thoughts on this as far as that integration with Connect and 211? I don't know. The only other guide I can think of that is out there, and maybe somebody else has and certainly we have websites too, would be the LAC, the Local Advisory Council, put out the mental health guide that is out of date. And I know they've been working on it. And I believe that NAMI is involved in that. So those are, you know, would we integrate in some way with their work, or at least they know what our guide is and we know what their guide is, I suppose. So, I mean, that's the only other group and website, you know, or organization that I know that's doing something similar to what we're doing, but they aren't necessarily vetting anybody in any specific type of therapy or focus or population or. So should we go to the next? We've got 2 more questions. So is there a primary website that will be the home for the guide? In addition to housing the printable guide, what else might this website contain? Ongoing training information, coalition information, key links, other. So what are your thoughts?
I would say a good approach would be to use the website we have, the Helena ECC website, since that is fairly new and it's built in WordPress, so it's easy to add things to. So I think that there's definitely opportunity within the maternal mental health section. Right now we host like the podcast episodes on there as well, but really linking through that or building a page that more people can access through that website that is specific to the resource guide. I think that's definitely doable.
That was my thought. I mean, I think, you know, I know they worked really hard on our ECC website, and it's, you know, I think it's really key, and because it is a living website, and I think that we can post, you know, the training, the coalition, you know, our task force information. And I think it's also a place where we can, you know, maybe put links like to the Postpartum Support International or Maternal Mental Health Now or 2020 Moms, and, you know, just have links to those resources. And people, I don't know how much traffic our website gets, but I think I don't know, does it very little? So maybe we'd have to really, this would be an opportunity to get our website having more traffic. So.
Well, I also think that, you know, I mean, I see where that makes sense, but that we would really need links to that website to be in places like, you know, Lewis and Clark Public Health and St. Pete's, you know, because for most people, early childhood coalition does not equate to perinatal mood and anxiety disorders at all, right? So people not familiar with, you know, kind of this intersection would never think to go to an ECC website, I don't think, unless they already were familiar with it. You know what I mean?
Sure, that makes sense. And, you know, is that an opportunity then for us to really reach out to all the different organizations that provide services for parents and moms, babies, everybody, and say, you know, here we are, and this, you know, our website, and Maternal Mental Health has their own page, and, you know, and you know, I mean, so do we put that also on the resource guide? Do we somehow have a way of showing a link somewhere there, you know, that somebody could go on to know that they could get more information?
Yeah, I think that the most valuable thing we can do with this is that sort of link outreach, because not only are we putting it in places that people are looking for the information already without expecting those places to build anything new. But it also gets the Google juices flowing. So the more places that are linking to this page means it's more likely to show up if people are Googling these things, which is like a really simple way of saying SEO. But essentially, the more people that are talking about it and that have more power, like Lewis and Clark is a .gov. I don't know what St. Pete's is, but anything that is like a more powerful URL that is linking back to ours helps us ultimately show up in Google.
Okay. All right. Other thoughts or comments on that question? All right. Yeah, I think that's important. So, all right. Well, I think we are at the last question here, and we're doing really well on time. It's 20 of. So, where will you garner your email list of providers, services, stakeholders that will be invited to fill out the vetting tool survey for the guide? Are there key partners that might share lists and communication vehicles to accomplish this? So, thoughts on that?
I would say this is the piece that Emily and I are kind of working on already, is putting together that list. Though we don't have too many emails yet, but starting with the list of names that we could possibly reach out to in order to get emails from them. But one thing we were talking about the other day is making sure that we have a few representatives from this task force take a look at that list, because I think Emily and I are both new to Montana and the maternal mental health community. And so to your point earlier, Dana, there might be people who have moved on or don't actually have the background that we think they might based on simple internet and lists. So I think we're starting to collect that, but there should definitely be a little bit oversight of just the list of names we're building in general.
Okay. So it sounds like you would like to have the maternal, at least some members of the maternal mental health task force to help look over the list. And so I think that makes sense. And are there other key partners that we can think of or stakeholders? I mean, obviously, we can think back to Connect and we can think back to St. Peter's and the work they've done. Other thoughts? Other stakeholders that we can think of? I mean, do we look at like other places that provide services? I'm thinking, and this is just off the top of my head, so I'm not saying that this is where we do it, but Florence Crittenden, the Wings program at the YWCA, are those stakeholders that we want to be involved or ask, or any thoughts on that?
I would say that's a really good thought, Dana, and to think about, really what entities work with families and kids especially in, with any kind of a treatment focus, right?
Right.
Yeah, so places like Florence Crittenden, the Y, absolutely, they've got resources that are available to the community that would be important to list.
Right. And so, yeah, I'm just thinking is that, and I guess not, because I'm not very savvy about all this, but knowing, when Bree comes back in December, like, was there something specific that she was thinking of, besides, as far as the survey for the guide, is that, finding out from other people how they would use it? Do they think it's important? So,
The way I read this of what it's asking is like, how do you identify who will be vetted, but
okay.
also like how do you reach those people besides just an email? Because even if we have their emails, they might not respond because they're unfamiliar with us as an organization, right? So are there other organizations that they might be more closely connected to that we can communicate through? And if it were not such a niche group, like I think examples would be, say, like physician associations or mental health organizations, like where people have membership. But I think in this case, it's such a niche group that you wouldn't really have those organizations, if that makes sense. Like there's not a Helena area mental health practitioners that serve parents club.
No.
But that would make things easier, right?
Yeah, it would make things a lot easier if we had
Yeah.
that, but we don't. So,
Yeah.
but that helps. Okay, so I mean, so we have Florence Curtin and we have the Y. I mean, um, anything else we could think of? I mean, certainly the public health department. I mean, they provide services, so home visiting, the nurse family partnership. I mean, just and other. So, anybody? Go ahead.
I'm also thinking about, I mean, I read it as, yeah, I mean, who all do we reach out to send a tool to find out if they're vettable?
Right.
And another idea is just, Montana, Medicaid mental health providers, like you can get a list of that from the state, right? So.
Yeah, I think you can.
You can.
Okay, so and I really feel, I mean, I think that question from Jennifer was really key, is that I do believe that we need to have some indication of who takes Medicaid, because that, since many of our folks are that population. So, and I think it's important that they are directed to those people that do take Medicaid. So they're not frustrated in the process.
That could look as simple as just like having an asterisk or something at the end. Just
yeah.
Bottom.
Yeah.
That works for sure.
Yeah, I think that's important too, though.
Yeah. Other thoughts on this?
So as far as like reaching the providers with St. Peter's, I'm happy to help with that. Just because I've built rapport with a lot of them, and they would potentially, like, if for some reason they're not getting back to the main email and whatnot, I can follow up on that part. And I get, like, my first sort of thoughts and interpretation of this is I still feel that we're going to find a need for education, and that there's going to be a lot of holes. I don't think we're going to have a ton of people that are already trained with PMADs, So then looking at that as an opportunity to really encourage, connect, getting people connected and encourage that. And then I even think of like, some of the places like Florence, Clinton, and YWCA, and our organizations that serve that population. And when it comes to referrals for patients, a lot of times there's not a choice, like this is it. So it would be, awesome for those organizations to also, embrace some education and getting educated. And I really, especially a lot of the patients that I work with, I kind of have a handle with care approach. And, I want to have even more confidence in referring people to somebody within the community that, they'll be well taken care of and understood, and then, referred back to other resources if it's found that they need something further, or other, they tell this other person things they didn't tell me, and other things come up.
Right. All right. Other thoughts before we maybe finish out the session today? Any other thoughts on the questions we've already answered, or this question? Okay. I'm not hearing anything, so I'm guessing that that's a no and that we're ready. So one thing I didn't do that I wanted to do ahead of time when we first were introducing each other, so maybe this is a good way to end. So I'll ask everybody this question, just to maybe send us on our way in a positive place. But where do you feel most centered and happy? So that's the question to answer, and I'll start so that I break the ice. And so when I thought about that question, I think I feel most centered and happy when I'm in the wilderness, when I'm backpacking. That's really my go-to place. So I'll just let people jump in, or I can name you, but I'll let people jump in first.
Lately, it's been when I'm playing with my grandchildren.
Okay, yeah.
We have our new home, and they come and visit, and we just get to hang out. And, breaking dirt clods with your grandson is just about as much fun as you can have. So yeah, that's a pretty happy place.
Okay, all right.
I'd say your grandchildren are very lucky, Jeff, to have a grandpa like you then. I feel like this, I know I answered the same way at our last question, so I'm wondering if I need to get out more, but I immediately go to my favorite place at my cabin on Swan Lake, my happy place.
All right.
When I'm in my garden, I feel very grounded.
Okay. That's
Even if it's pulling weeds, it makes me happy.
okay. All right. Anybody else? Megan, I'm just going to call on you.
I would say when I'm like sitting outside in the sunshine with my friends. So whether it's in the wilderness or even just at a brewery. So places that are harder to find nowadays, but definitely bring me joy.
Okay. Kelsey.
My happy calming place is in the water. And that can be any type of water. I was a competitive swimmer in middle school and high school, but so I love pools, but I also in the summer enjoy lakes when it's hot. The ocean is amazing. And even if it's like just my bathtub, because with our right now, sometimes that's it.
All right. How about you, Christina?
I would say recently I have a new reading chair, and it's oversized and comfy right by the window and get a blanket on with a pug in your lap and just pure quiet. I get pretty centered there, and it's been really nice. So yeah.
All right. And last but not least, Emily.
Yeah. I'm right there with you, Kelsey. That's exactly where my mind went, was like anytime I'm in the water, I always feel like I'm coming back home. Just it's like the closest thing you can get to flying. And I don't know, I just love the hot springs once upon a time, a swimming pool, getting on the river. Our favorite place is Flathead Lake, and I could just like float underwater all day there. Yeah.
Okay. Well, thank you all for sharing. I think it just helps us know that we're all here together and all part of this human race together. So I think we can end the meeting unless anybody else has any closing thoughts. I appreciate everyone being here today and participating in this. I think we had a really good discussion. I think we're on target to move forward. I think, you know, we'll review this whole document at our next session and just make sure that we're on task with that and then move forward. So, I hope, I guess, a week from today is Thanksgiving, and I hope everyone can have a happy and safe and lovely Thanksgiving. So, okay.
And thank you, Dana, for always for facilitating us so wonderfully.
Well, thank you.
Appreciate
it.
I appreciate all of you, and you all help me do it. So, because I'm not the best at this. So anyway.
Great. Thank you.
Okay. All right. Hang in there.
Yep.
Take care, everyone.
Thank you.
Thank you.